Hey guys, and welcome back to Learn Your Body Thursdays. My name is Dr. Chris Sovey, and in this episode we're going to be talking about the sacrum, sacroiliac joint, particularly about pain related to the sacroiliac joint. And this is going to be primarily for people that are having a chronic dysfunction in their sacrum. This series, we started down at the toe and we're working our way up through the body through every major joint. And now we've landed on the sacrum. We last did the hip, and the two are closely related. Of course, the sacrum being impacted by the hip joint, and also the sacrum being impacted by the lumbar spine, particularly L4, L5, the last lumbar vertebrae of the spine. Now, what we're going to talk about in this video is I'm going to give you one specific, if you only do one thing, I'm going to give you this one thing to do at home. After we go through just a little brief, you really need to have this background, a little bit of this just very basic anatomy, these bony landmarks, so you know how to assess yourself. That's how I treat people. I really want people to understand themselves better, be able to assess themselves, and be able to treat themselves as well. Now, disclaimer, that does not by any means mean that you should replace a professional for treatment if you're having an ongoing problem. This, if you're somebody that has hypermobility like Ehlers-Danlos syndrome or some other generalized hypermobility, very different approach than this. This is for somebody that's just been stiff, they've been sitting at the computer a lot, or they have a very stiff low back and sacrum. If you watched yesterday's video, actually, I did a little bit on how to sit properly to get rid of SI joint pain. Now, I'm going to give you a way that you can assess yourself and then also put that into practice into an exercise. So we want to take a look at the structure of the pelvis here once again. We have two sides of the pelvis. These two bones are called the innominates. You can see a side view here. And then in the center piece of that is this triangular shaped and sloped piece called your sacrum. Below that is your coccyx that, can create some real problems for people if that breaks off. A lot of people, when they say they have SI joint pain or sacroiliac joint pain, they're referring to this joint here. And as I discussed yesterday, one of the things that happens is a lot of people get what's called a sacral torsion. A sacral torsion is when there's a twisting of the SI joint, like so. It can go that way. It can also go this way. There's two different little axes that go through the sacrum. So it can create a twist in one direction or another, or sometimes a combination. Or sometimes it can even slip up. I mean, that's a little more rare. But the majority of people are going to have what's called a posterior sacral torsion on one side, and that happens from crossing your legs over frequently, or if you have a hip problem. So those are things to take into consideration when you're thinking about, why is this a continual problem for me? Why am I still having this? It's highly encouraged to see somebody that is trained in manual therapy that can help you with this and see if something in the sacrum needs to be addressed, or if it's being driven by the surrounding joints like your hip or your low back. So for instance, if you had a herniated disc or a severe scoliosis in your low back, that can absolutely throw off your sacrum chronically. Now the nice thing about what I'm going to show you here is this can apply to everybody, really, except for somebody that has hypermobility. This wouldn't really be a good thing for you to do. But somebody that's got some stiffness or a sacral torsion, you can find out how to correct yourself through a process like this. When you look at the sacrum, when you look at the pelvis as a whole, I want you to think about the way that the pelvis can move. So if we have the pelvis in front of us and we're thinking about walking, there's going to be three primary movements. In the pelvis, we're going to have this kind of motion, right? So that's like a rotation. This happens in walking, it happens in running, several other types of motion. There's also a slight dropping of each hip. So there's a twisting, there's a dropping, and then there's also a little bit of a nod of the pelvis that occurs too in walking. So you have to be able to do all three of those types of motions and do them well. So here's what I want you to do. You're going to need something like a deflated ball, like a little soft deflated ball. If it were fully inflated, this is 8 inches in diameter. You can go to a grocery store, go into the kiddie ball pit, and and get one of these and deflate it. This is actually an overball. It's a Pilates piece of equipment. And you're going to want to sit on a surface that is slightly above hip level. So your hips are above your knees. And the reason for that is it's going to make yourself easier to move through those different movements in the pelvis. And so when we go to sit on the ball, we first want to take a moment to observe some of the bony landmarks. You're going to want to put your hands around your hip crest. If you kind of slide down off the rib cage, you'll feel a ledge there. If you've got a little extra tissue there, you might have to push in a little bit till you feel those ledges. And then just sitting on the ball, you want to see in there, can you feel those ledges? Do they feel pretty equal? Are you tilted off to one side? Yeah? Wrap your thumbs around to the back until you feel what's called your PSIS. Those are going to feel like little protuberances that come out and they stick out. And then right inside that is your sacrum. If your hand is wrapped around to the back, your thumbs are wrapped around to the back, then again, we'll start to try and drop one hip slowly off the ball, and then we will drop the other hip off the side of the ball. And what you're doing here is you are observing for the quality and the quantity of motion. We are not trying to force one side down. We're not trying to do anything like that. We're simply observing, and we're coming back out. And then we're observing the other side, and then we're coming back out. And the purpose of this is assessment, right? So you can see, is there an imbalance from side to side? And by doing so, then you can use that to help mobilize those areas of the sacrum and of the pelvis. So, and this will actually mobilize the lumbar spine a little bit too if it's stiff. So you can work and you can come up to that barrier there, and then you can back off. Then you can go over to the other side, and you can back off. It's not this. It's not this big swishing motion. It's a controlled fall off to the side. And my midline stays, like my buttons on my shirt here, they stay right where they are. They don't move. So then you've assessed the first plane of motion in the pelvis. And you'll know if the sacroiliac joint is involved in that because you may feel a little bit of a pull or a stretch here. If you feel pain, especially sharp pain, you need to stop immediately, or any discomfort. So that's the first motion, the side to side. The second motion is we're still going to wrap the hands around to the back of the pelvis, and then we're going to go into a backwards and a forwards tilt. The ribs are back a little bit, the abs are in, and then we're simply tilting from the pelvis exclusively. Nothing above that line, those last couple lumbar vertebrae are moving. It's just the pelvis that's rocking. Now what you will notice, especially if you have an SI joint problem, is you will notice that one side will move more freely than the other. Here's what I mean by that. If you start to go into a forward tilt, the left side of the pelvis might come forward more easily than the right side. So the same could be true when you rock back and flatten the spine, which is happening because you're moving the pelvis, by the way. Again, we're using that as an assessment tool. You could even use your thumb around that little bump back there to encourage one side to move a little more freely, to catch up to the other side. So that's called the sagittal plane. We live in that world, right? Everything is this. It's this, computers are this, screens are this. We're always here. We're not moving in the other planes of motion as much. So assess that. Find the areas, the imbalances, and then use your assessment to help guide how you're going to fix that. The third one is rotation. It is this motion where we're coming like this. Now, when you're on the ball, the best way to think about this is, by the way, feet are on the floor for all these, very important. Feet are on the floor and your knees are parallel. And then what you want to do is you want to imagine you're reaching one kneecap to the wall that's in front of you. So you get a little twist, and then the other side will come forward as well. And you can shimmy forward and back. What you don't want is this, and then the other side hiking up. You're a level plane here, guys. This has to be level, and then we rotate through the pelvis so we get strictly a rotational plane. Like I put a pole right through your spine, and you're spinning around that pole, isolating just that motion. Now, the beauty of this last one is you can actually use that to help correct a sacral torsion, like a twist in your sacrum. Now, again, guys, this is educational purposes. You need to be assessed. This is at your own caution here, because we're getting into a little more advanced stuff of manipulating yourself. So you can drop your thumbs off of that little PSIS, the posterior superior iliac spine, and you'll feel like a valley there. Then you're on your sacrum. So let's say you, like most people, have a sacral torsion where the right side is dropping back, like so. You could put your thumb right on that sacrum, and then you could do the left rotation where you're reaching that right knee towards the wall in front of you, and give that just a little gentle nudge, and then you come back out, and then you give it a little gentle nudge, and then you come back out. And you keep doing that until it wants to move. And if it doesn't move, then that's a sign that something else is up and you need to address that, whether it's your hip or it's your spine. And that's, again, where you're going to require further assessment. So that is one way that you can assess and treat yourself. I would love to hear a little bit more about what you've done to help your sacrum. There's so many different techniques out there. Muscle energy is another technique that you can use on yourself. Easier if a provider is doing it for you. A lot of positional releases, even myofascial release can help with these sorts of things. So what sorts of things have helped with you? What kind of things are you still struggling with? I would love to hear about it in the comments section below. So thanks so much for joining me today. This has been another episode of Learn Your Body Thursdays. Tomorrow is TGIF, Talking Gut Immuno Fridays, where I talk about gut health, sinus health, and improving your immune function through lifestyle changes. So if that sounds like something that's interesting to you, be sure to check back tomorrow. And if you're new to the channel, be sure to subscribe and hit the little bell so you never miss another video again. Thanks so much for joining me, guys, and I look forward to seeing you next time.